representative, because we see that each workshop brings something new on the table, and it's worth to continue and worth to improve the method. So thank you, Kasia, for inviting us to this method, and thank you, Anne and Professor Verla and everyone to room for us to show you our workshop and our effort. So thank you for that. And if there's any questions now or later, please feel free to reach us by email, by phone, and other means of communication. Thank you.
Thank you very much, Thomas and Katia. That was very interesting. Transition still, it's a major goal. So, Anlo, you did show your hand, you hang up?
No, I was just, you know, using the congratulation, the clap icons.
Yeah, thank you. That's kind of you. And you too, because since you joined the patient community of ITHACA, you're very active, and we can thank you for that too. So, do you have some question to this presentation? Or do we jump to the quality of life, because it's the following subject, but it's so liaisable. Okay, so I jump. So back to Dorica. Dorica, are you gone? Are you disconnected?
No, I'm here.
Oh, okay, good.
Sorry. So I know that I have only 5 minutes, and I'll be very short. We are at the very beginning of our work on this field, and in fact, I used several slides from our previous work as EPACs or as patient organization and members of EURORDIS. And the first one is about the quality of care, in fact, influencing the quality of life, and our work that was mentioned today on identifying common needs for when we created the patient journeys for 5 different rare diseases. And we realized that genetics is the key for many ITHACA syndromes. And however, it is only one aspect of child and ERN ITHACA needs to go beyond the genetic diagnosis and think about holistic needs of the patient's community. And common needs include also early diagnosis, timely access to therapies and treatment, ensure mobility and independence and self-care, living, psychiatric and psychological counseling, integrated care planning, case management and care coordination across the life journey, with careful transition to adulthood of our children, and all these are the foundation for all. Next slide, please. Then the definition of the quality of care, and the first definition is the World Health Organization definition that it states the degree to which an individual is healthy, comfortable, and able to participate or enjoy life events. And Collins Dictionary, which say that it is a state of complete physical, mental, and social well-being, not necessarily in the absence of disability or of disease. I also mentioned here the work that we've done in Novcare in order to give the voice to the social and everyday needs of people living with a rare disease, and addresses the need of coordination between service providers in European Union member states. And the Rare Barometer survey that is more known by our IPACs. And we realized how severely is affecting rare disease and impacting rare disease on patients and families. And these are some of the figures that show this impact. 5 out of 10 patients have difficulties with controlling behavior, taking care of their finances and everyday administrative tasks, and also it influencing their personal care activity. 4 out of 10 patients have difficulties with communicating with others or understanding and learning. And 7 out of 10 patients have difficulties with their daily activities and motor, sensorial functioning, or social life relationships. And all these are affecting and producing disability, mainly severe disabilities. Next slide, please. We have measured the impact of rare disease in off-care project, starting with the assessing the impact of the rare disease on their mental, social, and physical functions, evaluating rare disease patients' access to social and healthcare services. We were exploring the challenges and difficulties surrounding coordination of care, and we tried to bridge the gaps between social, medical, and educational services. We have evaluated the economic burden related to the rare disease and addressing the impact of the rare disease on employment and job careers. And we were exploring the impact of the disease on family life and their well-being, even if we know that quality of life is highly subjective. And we could find patients or disabled persons saying that their life is good, and people which were not so affected and complaining because they had an event recently, and so they saw everything in black. Next slide, please. Of course, health is wealth, and quality of life is somehow the summary of your entire life. So you can answer to questions like, is it good or bad? Do you have enough money? Are you eating well or healthy? Can you afford to buy what you need? Are you happy? Do you have people to support you? How stressed are you? Do you have a personal assistant, or do you ever feel depressed or unable to engage in your daily activities? Next slide, please. We should not confuse the term of standard of living with quality of life, because standard of living is concentrated more on the economic factors, while the quality of life is more subjective, as I said. Next slide. How do we measure the quality of life? The quality of life measures are designed to enable patients' perspective on their health and healthcare intervention on their lives to be assessed and taken into account in clinical decision-making and research. But we have to understand that for some patients, sometimes these measures can't be assessed because they have cognitive impairments. It's very difficult, not that they can't be assessed, but it's very difficult. They have communication deficits, and or they are in severe distress. And there is a list of indicators that was set by Eurostat and which are dedicated to quality of life, 8+1 dimensions of the quality of life. And they refer to material living conditions like income, consumption, and material conditions, productive or main activity, health, education, leisure and social interactions, economic security and physical safety, governance and basic rights, natural and living environment. Next slide. So we are at the very beginning of this, and what I'm trying to say is that all the aspects of life are very important for a patient, not only the treatment, because in a rare disease where it's difficult to get a diagnosis and it's difficult to have a treatment, we are tempted to concentrate only on this and forget about the everyday life. But when the world say give up, hope whispers, try it one more time. And we have to support each other and work more for to provide holistic care for patients with rare disease. Thank you very much.
Does someone of you has a comment to add or a question? Well, I know we're 25 minutes late now, but it's not a trouble. Was very, very interesting, Dorica. Thank you very much.
Can I make just a short comment? It's Andrea from REN. You know, I think it's a very interesting presentation, and it's really the core of a very deep existential question, which doesn't concern just rare disease, but it concerns also COVID-19. You know, how important, you know, can we, I don't know if you say in English conciliate, but can we try to make things go on together between the economic problems, the standard of living, and life itself? You know, we are really at the core of this discussion in every country. You know, should we confinate, non-confinate? Should we preserve life at any price? Should we preserve the quality of life of the rest of the population, and so on? This is really, you know, at the core of our living together discussion, and it's really a major issue, and which goes far beyond rare disease. So thank you very much for your remarks and your presentation.
Thank you. It was just a brief presentation in order, because we are at the beginning of working together on this topic as EPACs, and hopefully we will develop this in the near future more. So, and work together. So we invite all of you to be part of this. Thank you.
Sorry, are you focusing on the age range, or is it something that goes from adults with handicap to children?
We were thinking to work on all entire life, yeah, to approach all ages, yeah.
I think there's something that was missing to my knowledge, and maybe it exists somewhere. It's a comparison of health system help that someone can have. A single example: you have a child with trisomy 21 of 5 years old. How are the parents supported? What is to their what do they have to pay? What is covered by state in each of the 27 countries of EU? This is probably very simple information to have for a few paradigmatic situations. You cannot do for everything, and of course, with the same child with the same disorder in the same country, you would probably have not exactly the same help for each of them. But it could be interesting to make this, taking 2 or 3 age range, a young one, a teenager, and an adult, and 2 or 3 type of specific problems, like an adult with multiple disabilities, a boy with Fragile X, and a boy with a myopathy and no intellectual disability. Just to have a comparison of.
Yes, I agree.
Which would be much simpler than to have a comparison of legal text, because this is probably exists somewhere, but legal texts are so complex that at the end you cannot understand what is going. So having use cases of, let's say, 3 or 4 situations in 3 age groups and compare them around among all the EU countries. Okay. And I think this could be published, because it's really something. When we are speaking out together, we don't understand, we don't know exactly what would be the problems for each of us in his own country to have just access to a speech therapist or to a physical therapist, or to have access to a special school. How long you have to wait to have the first appointment to a geneticist. just very basic things of real life, and that probably have a lot of impact on the quality of life.
Exactly. So it was just a brief presentation about the topic, and we wanted to introduce the topic, and we will decide together how to approach it.
If I could add something, I'm not sure if you can hear me because I have moved to my mobile.
It's fine, Kasia. Go ahead.
Thank you. So
Shout a little bit more.
That this suggestion on making this research on the quality of life in different countries, I think this is a very good and brilliant idea, because yes, it's a great idea to compare the life of people in different European countries, because I'm sure it's different. And the quality of life, what Dorica said, is also a very important issue. I think that if we think about introducing, I mean, in Poland, introducing, I don't know what it's like in other European countries, ICF. And when we think about participation and inclusion, treatment is only a small part of a person's life. When I look at my son and his life, quality of life for a child means being able to play with his friends, being able to go for a walk, being able to have an ice cream in summer. So I think that we often forget that life is more important than treatment. And it's not our goal to fix children or fix people. Our goal is to make them have a happy life. So, but because I often see that some people tend to fix children, tend to fix people. And we have to be very careful, and we have to find this balance that Tomek has been talking about, disease and life balance. And this is about the quality, I think.
Thank you.
Thank you, Kasia. And I think Cherry has also something to add.
I don't. Yes, go ahead, Cherry. No.
Yes.
Yes, sure.
Are you aware there is a very much a subjectivity in the quality of life? It's your perspective you have when you receive a child with a disability. Your world seems to crash together, and maybe the goal of should have friends is too far-fetched to become happy. In the Netherlands, there is an initiative called Positive Health, where they try to create your own measures on how to improve your quality of life. So it takes small steps, and every time you reach something, basically that is an award. Looking at the slogan on the world, when the world says give up, hope whispers, these small steps towards quality of life might also be interesting to research. They have a tool set where you can do self research or research on your child, and basically get your current situation and set some achievable goals. I think it's a very interesting project to look at.
Yeah, thank you. I think it sounds very interesting. Yeah, I'm very curious. I will read it. Thank you.
I think we should create a kind of working group or task force on quality of life within at least the IPAC, and I don't know the level of the ERN, if there is ITHACA, if there is something similar.
Yeah, it can be a working group across ERNs, I think, on the quality of life, because it's, yeah.
Absolutely.
Okay.
Do you have any other comment or questions?
When my daughter was born, I was listening a story, and in that story was called So Many Everests, and it was about a girl with a severe handicap And I realized that it is true that you can measure achievements, as Gary said, measuring the progress that your child have done. Because, for instance, my daughter achieved more than we ever dreamed, and because she's very determined, and we didn't expect so many things, and somehow life is beyond the expectation. And so it's interesting to measure this for yourself, to do a self-assessment for your own case. I think it's very interesting, and positive health sounds very good. Yeah, thank you. Okay.
Thank you very much, Dorika, for these comments. Very positive. We finish with a very positive note before we start with
Chris
presentation.
So Dorika, So Dorika invite us Chris and Hill. So
yes,
Chris.